Coming up on Healthy Thinking.
Sir Sam Everington is an innovator in general practice, a pioneer in the field of healthcare and a leading expert in social prescribing.
I often call it a conspiracy, actually, to retrain doctors. Because you and I were trained in the era where it was all science. No, it's changed, and this is really important. It's what matters to somebody.
His transformational approach to preventative and community healthcare as a GP in Tower Hamlets in East London has revolutionised the future of patient care.
A mental health trust reduced acute admissions by a third. That is stunning. How? They opened a cafe 7 days a week staffed by mental health workers. That's social prescribing.
As a junior doctor, he slept on the street to raise awareness of long hours. Now he's Vice President of the British Medical Association and shares his views widely on the future of primary and community care.
The GPs love it because suddenly there's this team of 1,500 voluntary sector organisations as part of their team. The patients absolutely love it because it's about them as a person. The voluntary sector really like it because they don't need to advertise their wares anymore. And as somebody who has to pay for health services, I love it because anything that diverts somebody from the NHS actually is helping the NHS. But most importantly, it's how this changes patients' lives.
This is Healthy Thinking from Life Sciences Hub Wales, a podcast series bringing new perspectives from leading thinkers in health and care innovation. It's presented by Professor Sir Mansel Aylward.
Sam Everington, welcome. I want to start with social prescribing. How would you describe the concept of social prescribing? How did the original idea come about?
So most of what we do as a doctor, what we're trained to do, is biomedicine. It's science. And yet Professor Marmot and a whole raft of people would tell you that probably over 70% of people's health care, health and well-being actually has a whole raft of other factors engaged in it. And how I would describe that in a simple way is if you're going to be holistic in terms of helping somebody improve their health, you have to look at their job, their education, their environment, and their creative side. The evidence is very clear, for example, that if you have a job, you will be healthier. If you get any improvement in your education, you will be healthier. If you engage creatively, now that might be gardening, it might be art, it might be music, it might be to do with your religious engagement. But if you're creative, you will be healthier. And then environment is about your home. If you've got a good warm home, guess what? You're going to be healthier. And so social prescribing, I often call it a conspiracy, actually, to retrain doctors. Because you and I were trained in the era where it was all science. You diagnose somebody, you worked out what the matter was with somebody, you then defined the treatment, and of course they took the treatment, didn't they? No, it's changed. It's now, and this is really important, it's what matters to somebody, which is really important. And it was lovely this morning to hear your First Minister quote that, not knowing where it had come from. And it tells me that this big movement now of social prescribing, we've infected the whole country without them knowing.
I think I can concur with you on that. But tell me, what are the benefits, the direct benefits of introducing this change into the medical practitioner system?
Well, if you look at it quite simply in a 10-minute consultation, suddenly you've got a whole new therapeutic armoury. So you can prescribe a drug, you can refer to the hospital, you can give somebody a leaflet or a virtual leaflet, but now you convert to the social prescribing team. So all my GPs in the East End of London have a referral form on their desktop. It takes about 20, 30 seconds to fill, so we make it very easy for the doctors.